Okay, so myself and Stephen and Ashok are going to do a session about how regulators can support positive experiences of care and processes of shared decision making. But before I start, shared decision making, I know, appears in the Patients Association jargon buster. So I just wanted to be clear about what we mean about shared decision making. And what the Patients Association say, which is similar to what the NICE guidance says, is where patients and clinicians make decisions about care together. And I think what I would add to that as well, where the patient is able to make the choice of the right care for them. And so that's what we're talking about today when we're talking about shared decision making. And what we want to do is to provide an overview about how regulators might be able to support positive experiences of care, to talk about the importance of making shared decisions for patients and for osteopaths, to highlight that our values might be different, and also to begin to think about the relationship between values-based practice and the implementation of standards, because that's what regulators are about. We set standards, but they only ever manifest, those standards only ever mean anything in a particular patient and clinician consultation. So what does the regulator do to support that consultation to be as positive an experience as possible for patients? Oh, that's who we are. Okay, so first of all, regulators. So regulators are beasts of statute. We're created by the law, which is, I think, a challenge when you're talking about some of what we're talking about today. We are the General Osteopathic Council. We're one of 9 health professional regulators, and we're responsible for protecting patients. We're also responsible for promoting and maintaining the health and well-being of the public confidence and proper professional standards. And that's what we all do, the General Osteopathic Council, the General Medical Council and others. And you know, on the face of it, you might think, well, that seems an okay thing to do. You know, health professionals don't argue with any of that in terms of what they want from their regulator. But regulators are really challenged. We are established by law, which typically means there is one right answer when it comes down to it. We've got the predominance of the regulatory complaints process. Regulators are known for their ability to restrict or remove people's registration, and that really causes challenges in terms of patient safety, I suggest. Why? Because either health professionals feel very defensive and defensive practice is enacted, or when problems occur, it's much easier to chuck them to the regulator rather than dealing with them locally, and both of those can really challenge regulation. The perception of regulators as being able to put their hand on a professional's shoulder is really challenging in terms of building relationships and trust and understanding that the regulator is there to support practice. We know from research by Jerry McGivern that it's only when people understand the why of the standards that they're actually much more effectively implemented. We also know that regulation can lead to gaming. People tick boxes rather than actually doing the right thing. And there's also, interestingly, limited evidence of impact, which is why this stream of work, I think, is also really, really important. But crucially, and you might be thinking, so what's that got to do with this quote on the screen? I think that's probably quite right. It's because it's about people choosing to make a difference. Regulators, like health professionals, are full of people who want to make a difference to patient care. And that's what we really want to do in the General Osteopathic Council. And that's what this stream of work really is all about. But it started with the amazing Stephen Tyman. People who have heard me speak before know that I've got 2 quotes from Stephen that really are the foundation of this work. And this is the first. Stephen talked, in fact, we met him. Do you know, it was almost 9 years ago when we had that first conversation in a coffee table, around a coffee table in Bermondsey. And Stephen, at that point, and I'm not sure he ever was a fan of regulators, but he certainly wasn't a fan of regulators. He saw us as rigid and immovable, and felt that actually there was a real gap in what regulators did. It's all very well setting standards, but actually there's much more to practice than setting standards. There's a set of values that sit behind that actually interact in a particular situation and make people behave in the way that they do. And he talked about this, and he taught us about integrity. And he taught us about integrity that could be something that comes from within, or it could be something that comes from our context, from our background, whether that be nationality, gender, religion, family, our profession, our workplace within which we interact. He said that these sense of values, which often have tensions within them, they actually influence how we act. And if the regulators ignore that space of values, actually we're ignoring what professionals do and how it actually manifests with patients. So it's really important that regulators engage with this kind of work. And indeed, if you take that to the end point of what Stephen was saying in relation to professional values, unless we engage with professional values as regulators, one might argue that we are not, in fact, implementing our standards at all. The other quote that I really resonates with me with Stephen Timon is this one, and he wrote this towards the end of his life, and he describes it as the practitioner's task not merely to explain and to treat, but to provide support and insight into the meaning of illness in order to enable a patient to develop a better life-enhancing narrative and become more of a whole person. What a fantastic description of what healthcare should mean to a patient. And he used to describe it as when you know, as we grow, when we're toddlers, we start to crawl and we realise that the ground is solid. And as we grow, our world becomes bigger and bigger. And then a health event happens and our world becomes very small again. And actually what Stephen described, the way he described this to me, was actually that it's the healthcare practitioner's job to help the patient's world to grow bigger again. And this really is this I've actually pinched from Professor Suzette Woodward, who speaks a lot about concept of patient safety too. But I love this diagram because what this says to me is that this is us, this is regulators in the middle there. We are in our ivory towers creating beautiful standards and frameworks and ethics, if you like, that people don't often disagree with. And then out there in the real world, that's where patients and practitioners are, in the messiness of reality and human interaction, trying to do the right thing. And it's really hard. And I think that's one of our messages today, that we recognise that as a regulator, that it's really hard. We set standards. So at the General Osteopathic Council, we set the osteopathic practice standards. The General Medical Council set good medical practice, and all of the other health regulators have codes of ethics and standards. And what we imagine as regulators that these standards are is not a set of rigid rules, but we actually want them to be embedded and embodied for practice. So we want them to define behaviours that represent good practice, create the best environment to facilitate that good practice. And we want to support osteopaths to practice in accordance with the standards. And we kind of describe that. We want people to think about the standards, to feel the standards, and to sort of do the standards as a framework for practice. We want the standards to be a framework that enables professionalism and doing the right thing to flourish. But as I've already said, and this is the plant growing and flourishing like a professional. But as I've already said, it's really hard because people think about us as setting rules and with rigid kind of answers. But actually, we're trying to move away from that. We're trying to move towards focusing on people and values, which is the reality of what healthcare is. So Stephen introduced us to the wonderful Professor Bill Fulford, who sadly can't be with us today. But Bill has written, this is an amazing book. If you want to know anything about values-based practice, I thoroughly recommend at least reading the first case in this book, which is about Ray, a builder, and Dr. Gulati, because for me it really summarises some of our challenges around values-based practice. And Ray is a builder in his 30s who has been getting 6 certificates from his regular GP. And Dr. Gulati is another GP that comes and sees him and is concerned to issue another 6 certificate. And so it's an everyday occurrence, which actually embodies some of the challenges that we have with values. You've got the clash of the patient autonomy. I want my 6 certificate. You've got the clash of being fair and honest. You know, you've got the clash of evidence-informed practice and a whole range of other values. So it's not just about ethics. There's a whole range of other values that kind of come through that discussion as well. And Bill said Did you know that evidence-based practice wasn't just about randomised controlled trials? The osteopaths will like this. It's not just about randomised controlled trials or any kind of research. That's just a small part of it. And he talked about what Sackett said. Sackett says that evidence-based practice includes patient values. They are a necessary part of evidence-based practice. And by that, we mean the unique preferences, concerns, and expectations that each patient brings to a clinical encounter, and which must be integrated with the best clinical research evidence. But that's the bit actually that's really hard, because what you're seeing there is you're trying to understand what the patient's individual concerns, preferences, and expectations from shoes that are not the patient. And that's a real challenge in terms of eliciting what's important to both the patient and to the clinician. So all this talk about values then was embodied into law in the Montgomery judgment in 2015. So the Montgomery judgment involved a case where a patient, and it's very topical actually, because it's come back so much more in relation to some of the inquiries that were published this year. But the patient was not informed of the risk of shoulder dystocia and therefore options for caesarean, and that caused real problems. And the argument really related to whether the patient should have been informed in that, given the nature of the risk. And in fact, in that judgment, for the first time, they took the point about patient values, that it's important to elicit the patient values, and they determined that it was the body of opinion that was relevant, was the body of opinion of the reasonable patient as distinct from the reasonable practitioner. And so for the first time, what we saw that had been actually in all of the professional regulators' codes of practice, we saw that really crystallised in law as well. So that's a bit of the background. We're interested in with osteopaths, we are a small profession. We've got about 5,500 registrants, and osteopaths also work primarily without employers and teams. And that's really interesting, because that means that the values that can obscure perhaps or influence some other professions that may work primarily, for example, in hospitals or in other employed kind of environments where the culture and organisational approach may influence practice and the values that arise from that. Actually, with osteopaths, they don't have those kind of factors. And also, what's very interesting about osteopaths is that the level of satisfaction is really high. Look at that, 9 in 10, actually up to 95, 96% of patients felt that their osteopath was excellent or very good. So we're at the high end in terms of patient satisfaction. But even in this area, what we find there, I don't know if you can see it on screen. Hopefully you can see it better on screen than we can in the room. But actually, these bars, they represent excellent is red, the next one to the right is very good, and the next one is good. So basically, they're ranked, if you like, in order. And what the things that were at the bottom of the order, even though still very good, were explaining things clearly, fully understanding my concerns, helping me to take control, and making a plan of action with me, all of which relate to the patient values that we're talking about today. So there's even room in excellence to be thinking about the values of the patient and values-based practice and how we implement standards. So what have we done? We've been on a journey. Welcome, it's great to see you. We've been on a journey, and our journey started in a room very much like this, with a group of people very much like this. In fact, probably some of you were there. We did some exercises which Ashok is going to take you through to kind of help you understand our journey. And we did those exercises, and we discovered there was a set of values that related to osteopathic care. And what we did with those values was we themed them. So we did the workshop. We said, great, here's a set of values. What we can do with our profession is take those values away. We can theme them into a framework. Regulators like frameworks and kind of overarching models, if you like. And so we did that, and we themed, in fact, all of the values fitted into this theme of care, competency, professionalism and context. great, we thought we've cracked it. We'll take this framework back to a second workshop, we'll test it out, see how it works, and then we'll publish that, and everybody will do values-based practice. Sorry, excuse me. So guess what? Do you think that worked? Was it successful? It wasn't successful. And it wasn't successful because everybody argued about the framework. It didn't work. It didn't highlight professional identity enough. It didn't highlight professional boundaries enough. We'd started at the wrong place. In fact, where we needed to start was our collaboration between patients and practitioners. And that's what we did. We did a third workshop, and the wonderful Kate Waller and Rebecca Addison from Community Research, the General Dental Council, and colleagues at the Collaborating Centre helped us to work through that workshop. And what we actually found was through their stories, they all brought stories. I'm really sorry, I'm going to have a cough, which is a terrible thing to do in a recorded session. They all brought their stories, and then what we found was that there are various enablers and barriers to good care. Thank you so much. I'm really sorry, I was unwell about 2 weeks ago, and now I've got a cough that just won't go away. Thank you so much. So what did we find? What was an enabler to a positive consultation, and what was a barrier to a positive consultation? Enablers were typically things about listening and time, but barriers were both environmental, again, listening and time, but particularly they included pain, anxiety, stress, external factors that can really impact on patients being able to be in the room and be able to express what's important to them. And so we took those findings. And sorry, I put these slides in here just to sort of show what do you see there? A cup, okay. And what do you see now?
Two people looking at each other. It looks like Prince Charles.
My husband said it looked like Churchill. I've got no idea, but yes. But the point is that we can see the same shapes. We can see them in different ways. So we can see things differently. And that was my point earlier on about patient preferences, that even we're not standing in the shoes of the patient. So actually really understanding them is always going to be very, very difficult.
I think I like what you've done there. You use a good image, because sometimes as a patient and caring for my mom, I find that the clinicians see the vase and I see the people, or they see the people and I see the vase, but actually we're both seeing the same. Actually, we're both seeing something which is correct, but we're just not understanding each other.
Yes, different realities, and it's all true, but it's a different lens on that, or the truths are different for sure. And so all of this is really, really important to us, and we've only just scratched the surface as to what we should be doing as regulators. And I don't say this is the whole answer today. This is just a start. And what we've been doing, so as a result of the feedback that we got from that third workshop with Community Research and the General Dental Council, what we actually did with patients and osteopaths was develop some resources to help both clinicians and patients make much more explicit what is important to them in a consultation. So what we learned was that you can't just, there's no magic question. You can't just say, so what's important to you? Or, you know, how can I help you today? Actually, it involves a lot more of a deep, complex conversation often. And so we've done some resources to try and support and help that consultation. And you're going to hear much more about those today. So that's it from me. I'm going to hand over to Ashok, who's going to take you through some of the journey now, and then Stephen, who will apply that in practice. So thank you very much.